I'll be out there waging a great campaign from one end of the country to the other, telling Americans with insurance or without insurance what they stand to gain.
President Obama to the Democratic House caucus. That's all well and good, Mr. President, but I think your fellow Democrats would like you to add a couple 100,000 jobs each month to the payroll.
And if this campaign's going on across the country, it makes you wonder what corner of the country includes Massachusetts. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Rick Klein.
Each weekday we're bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics.
And it's twitter.com/thenote if you want to let us know what you think, if you want to solve healthcare, whatever you want. We're here.
Solve healthcare. It feels like we are approaching a massive election day, but get us started with your top line today.
We just might be. CADILLAC keys. The latest big sticking point in the healthcare bill is solved. Unions last night announced an agreement with the White House and congressional Democratic leaders that they say addresses the concerns that they've had about the so-called CADILLAC tax. It scales back slightly and more importantly, pushes back the effective date for collective bargaining units so that this won't happen until 2018 for if you're a labor union that's made it happen. Chugging along here. It's happening slowly, but it seems to be happening nonetheless. We expect that the sport will be where it needs to be on the Hill. The thing that's really motivating, though, is the chance of a 41st Republican senator. That seems to be the biggest force.
It does, although I'm not quite sure how that works out timing-wise, because there is still a lot of time here in terms of getting a CBO score. Lots of Democratic moderates do not want to say where they're going to be on this final bill without seeing the price tag, Rick. And you know Mitch McConnell is not just going to roll over. They're going to try to delay this vote some bit on the Senate floor. So I just don't know that the timing here, they need to focus on getting a Democrat elected in Massachusetts if they want 60 votes. Toss up. Yes, everything and the kitchen sink. That's what Dems are throwing at the Bay State. Rick and I were just talking about that Massachusetts campaign. Might President Obama make a last-minute campaign stop? He's certainly dialing up households in Massachusetts, putting out a robocall in support for Martha Coakley. We know that Bill Clinton's up there today trying to rally to the troops. Rudy Giuliani's up there on the Republican side. Ads are flying. This is a fully engaged battle right now, and nobody seems to know what the predictable turnout model is going to be on Tuesday.
No, it's a special election, and that always complicates things. And the question will be in those last couple days whether President Obama goes there himself. He's got a robocall out just today. They're doing lots of fundraising appeals. That Kennedy name is flying, but that's really the last quiver that the Democrats have left. Axe v. Rove. The two gurus are added on the op-ed pages of the Washington Post. David Axelrod taking it to the op-ed page today to rebut the charge by Karl Rove about President Obama's handling of the deficit. And I think a clear signal from the White House, David, that they're not going to back down from challenges, particularly challenges that are launched by people associated with the Bush White House. They kind of welcome Karl Rove's entry into the 2010 debate.
And it's something Democrats on the Hill want from this White House. They want them to take the partisan fight to the Republicans a bit more sternly than President Obama is usually want to do. But for people like us, Rick, Axelrod versus Rove in the pages of the Washington Post, I mean, that's just delicious. And Obama connects. Yes, the tragedy in Haiti continues. And finally, after days of trying to reach him, President Obama was able to get on the phone with President Preval of Haiti, mostly because I think the UN assigned somebody to be next to President Preval in Haiti to make sure the president's call could finally get through. He committed again and affirmed the American commitment, not just in the immediate relief efforts, Rick, but also in the long-term recovery of the country. President Preval sent a message back through President Obama to Americans saying he cannot thank us enough. Thank you, thank you, thank you.
President Preval, of course, among the many homeless in Haiti right now. And how telling is it? The President of the United States not able to get through with the head of state in Haiti. That's the situation.
Oh, my God. We are going to begin with the huge health care deal that seems to have been worked out last night, at least one component of it with this so-called CADILLAC tax. We're joined by Democratic Congressman Joe Courtney of Connecticut. You've been leading the charge, Congressman, to make sure that this CADILLAC tax is not in place. It actually still is in place. President Obama's promise not to tax health benefits is still a bit of a flip-flop here. It is in this bill. But let me get your overall sense about this deal that got struck, that collective bargaining agreements are exempt for now. There's going to be a longer transition period. Is this acceptable to you?
It's certainly significant movement in a matter of days, and I think that those of us who have been working on this since last October are very pleased that we finally, I think, got some real movement, as I said, with a proposal that many people a week ago thought was just going to be a fait accompli as written by the Senate. There's definitely, again, a change regarding, as you point out, a transition period for collective bargaining agreements. There also are changes that will affect non-collective bargaining agreements in terms of raising the threshold, exempting vision and dental secondary policies, which as a former small employer is something that I've been very concerned about. Those are going to be exempt in terms of calculating towards the threshold.
After 2015, yep.
Correct. And there also will be adjustments made for age, region, gender, and occupation, which, I'm from Connecticut, the land of actuaries. The American Academy of Actuaries has been pointing out the fact that the criticisms that guys like me have been making are on target, that, the way premiums are calculated and priced does not translate into necessarily the size of benefit plans. And at least what we're hearing, and again, at this point, it's just an outline that we've been submitted, is a more intelligent approach. We're going to get more detail next week, and certainly I'm reserving judgment until we get a chance to get our hands on it.
Congressman, the income threshold only actually changed by $1,000, going from $23,000 to $24,000. And I want to read you back this quote from last week. You said, quote, "The issue had tremendous potency on the campaign trail in 2008, and frankly, I don't see any indication that the change of heart that's occurred among the policy people in the White House has really changed the American people's hostility to the idea." Do you think that's true? Do you think that Democrats are really going to be facing a tough political climb here, that this could be used against Democrats in 2010, taxing health care benefits for the first time ever?
I'm not a fan of this, and still am not. Having said that, what I heard on the campaign trail or back home, which was referred to in the article, was in fact people who immediately were zeroing in on the fact that secondary insurance, vision and dental would be calculated towards the threshold. That's the reality for a lot of people who, again, aren't part of unions. And who buy their insurance either as self-employed or small business people. So again, I still reserve judgment. I want to take a look at this and whether or not there's an opportunity to include flexible savings accounts as an item that would be exempt towards the threshold, which right now, to be honest with you, is not very clear in terms of the feedback that we've gotten. But there's no question that in terms of the basic goal of trying to shield more and more middle-class Americans from the impact of a tax, which again is very kind of broad brush and crude in terms of its impact on people. There's been tremendous movement, and the good news is that there's going to be a time period of 3 or 4 years anyway until any of these tax ideas or revenue ideas go into effect.
Two of the major things that this tax did when it was in place as it was in the Senate version is from all across the spectrum in the healthcare debate, many observers say this is one of the keys you need to bend that overall cost curve down. That's one thing it does. And two, it raises revenue to make sure that this overall healthcare bill is not adding to the deficit. This change apparently is now going to cost $60 billion, it will raise $60 billion less in revenue. You guys are going to have to find that elsewhere to pay for this bill.
Well, first of all, the cost curve argument, which again, is a claim made by economists, I would say has been rebutted by the actuaries. I mean, it's kind of a fun sort of battle to watch the two nerd groups go at it in terms of how you really determine the impact on healthcare spending. I side with the actuaries because, again,
but what about the cost of the bill?
Where are you going to
find the $60 billion?
Well, again, having not been privy to the discussions, I don't have a real solid answer for you yet in terms of that. What I have heard is that the Medicare payroll tax, which was being slightly increased for folks above $250,000, may get revisited either in terms of extending it to unearned income or another tweak to the rate. But again, next week we actually are going to have, and Speaker Pelosi met with us this morning, said that we're going to have a detailed proposal, which she hasn't even seen yet.
Congressman, does it bother you that, forget the public access side of these things, you're a member of Congress. Yep. You were not involved in these end-stage negotiations. Union leaders, though, were. We had the heads of the AFL-CIO, SEIU were in the room. What do you make of that?
I'm not a neophyte to the process as someone who was in the state legislature. I think that's a way of Americans organizing and having their voices heard through whether it's trade associations or whether it's through labor unions. That really doesn't upset me that much, and clearly they were supporters of President Obama, and I think there was a concern that their voices were not being heard, and that's why these discussions took place as they did.
Congressman Joe Courtney, Democratic Connecticut, thank you very much for being here today, sir. Take care.
And we love nerd groups here on Top Line, no question about it.